Hey, I'm Dr. Joe with Chiropractic, and today we're going to talk about ear infections, especially chronic ear infections in kiddos, because we see this all the time, and it's the most common thing that parents bring their kids to the pediatrician for. Also, one of the most common reasons why parents bring their kids in to see us at the chiropractor's office. It's estimated that in the first year of life, about 66% of children will get their first ear infection. By the time kids turn 3 years old, about 80% of them will have had their first ear infection, with another third of those undergoing at least 3 ear infections, chronic ear infections. And it's estimated too that by age 5, almost every single child will have had their first ear infection. So obviously this is a pandemic that we're seeing in kids, with chronic ear infections popping up way too often. So we want to give you a little information with this video about what is causing that, how to prevent it, how to go about measures for looking at ways to limit the amount of ear infections, if any, that your kids will get. So before we dive into what chiropractors do necessarily, let's just talk about ear infections in general. So an ear infection, also called otitis media, a middle ear infection, happens when too much fluid and bacteria build up in the middle ear, and it becomes a breeding ground for the bacteria to explode, causing the infection in the body. So the reason why this happens is in kids, they don't properly drain the fluid in their middle ear. And the reason for that comes down to a little muscle that starts in the soft palate, so in the back, the roof of your mouth. If you take your finger and slide your finger along the roof of your mouth, you'll feel it's really hard for a second, and then it goes soft. That's called your soft palate. That muscle starts at your soft palate, and then what it does is it travels up and attaches to the cartilage along the eustachian tube. The eustachian tube is a tube that goes from the middle ear down into the sinuses, the nasopharynx, and what it does is it allows that fluid to drain when it's opened up. So looking at the anatomy and how muscles contract, they spasm, they release. When the TVP is in a spastic state, what it's going to do is it's going to pull on that eustachian tube, which closes it and doesn't allow the fluid to drain. So what you can think of just like this is a pool that hasn't been cleaned in a couple of years. It's full of green bacteria and algae and a bunch of junk. The same thing happens in the middle ear when that eustachian tube is pulled, because the TVP is spastic and in a constant spastic state, keeping it closed like that. So typically what will happen when little kids get an ear infection is they're going to be treated with antibiotics. And sometimes this may work to kill off a vast amount of the bacteria in kids, and they won't get an ear infection again, which is great. But a lot of times it doesn't work too. And the reason for that is not all ear infections are bacterial in nature. A lot are actually viral in nature. So when you get a viral infection, antibiotics really aren't going to touch it. But even more so, what we see is when kids are given antibiotics, it'll kill off a bunch of the bacteria. The symptoms will go away from a little bit. They won't have a fever. They won't be tugging on their ear anymore, which is all good. But then you look 6 months later and they're doing the same things. They're getting ear infections again. And the reason for that is that TVP is still in a spastic state. So it's pulling on that eustachian tube, creating another breeding ground for the bacteria. It just can't drain properly. So what we do as chiropractors, we approach it as, let's get rid of the spasm in that muscle and what's causing the spasm. So typically what we will look at, and especially in our office, we have the technology to really see if there's nerve interference in the upper cervicals that could be leading to the spastic state of this TVP. And if so, we adjust the spine, we regulate the nervous system, create a healing response which takes the spasm out of that muscle, allowing the eustachian tube to open up, the fluid to drain properly, so it's not a breeding ground for bacteria anymore. And commonly, we'll see these kids, they just don't have the ear infection anymore, or they don't get ear infections ever again. So again, specifically for chiropractors, it has to be well known that we are not treating or curing the ear infection. What we're doing is we're assessing the nervous system to see, is there any interference or disruption in the nervous system, the brain, the spinal cord, and the connection between the rest of the body? And if so, what's the outcome of that interference in the nervous system? So that is exactly what we're doing. We're looking for interference in the nervous system. We aren't treating or curing ear infections, but like I said before, it's amazing to see the response in these kids. If you're a parent and you've had children or your kiddos have had chronic ear infections over and over and over again, my simple message to you is just bring them into your local chiropractor to get them checked. Have them look specifically at the upper cervicals and see if there is interference within the nervous system that may be causing that repetitive over and over and over again ear infections. That's what we do. The kids we see have amazing results. I hope you learned something from this video. If you have questions, feel free to reach out to us. Our website is www.cottonchiropractic.com. You can always call our office too if you have more questions. 540-765-2990. Cotton Chiropractic, creating happy families and healthy futures.